This lecture, we will discuss on urinary system. In urinary system, we will discuss about kidneys, ureter, bladder, and the urethra. I believe if you have been to the lab, you have been exposed to all these structures on the cadaver, and you know the functions. So let's start with the kidneys. What are the functions of the kidney? It has three main functions, which are excretion. That's number one. Number two, electrolyte and acid-base balance. And number three, endocrine function. I believe if you look at this slide, you will understand what our kidneys do for us. And now, when we were in the lab, when we were dissecting the cadaver, and we saw these structures. Let's start with the site of the kidneys. Let's identify where our kidneys are. As you can see, kidneys are in the abdomen. It is an intra-abdominal organ, but let me remind you again, it is outside of the peritoneum. It is behind the peritoneum. It is stacked on the posterior abdominal wall, and therefore kidneys are retroperitoneal structure. And the right kidney is lower than the left kidney because of the liver, and upper pole of the left kidney will reach up to about thoracic 11 or 12 vertebra, but on the right side, it will be slightly lower, and the lower pole of the right kidney might be around lumbar 2, lumbar 3 region. And in this diagram, I want you to appreciate the adrenal glands, which are sitting on the upper pole of the kidneys, and they are triangular or pyramidal structures. And again, like as you see in the lab, we have abdominal aorta and the inferior vena cava and renal vessels, renal artery and renal veins coming out from these structures near perpendicular direction. And you can see like ureter, which is the structure carrying urine from the kidney to the bladder, is running vertically from each kidney, and they are running above the aorta and the inferior vena cava. So again, like as a reminder, our kidneys are retroperitoneal structure, and these are the three basic germ layers during our fetal life. We developed ectoderm, mesoderm, and endoderm. These layers, the whole body developed from all these layers, and our kidney, if you look at that, it is red color. It develops from the mesoderm, and it is behind the peritoneum. It is outside the peritoneal cavity, but still it is within the abdomen. Again, like very much similar to what we saw during our dissection. And I want you to appreciate the left kidney is closer to the aorta, and right kidney is closer to the inferior vena cava, because inferior vena cava is on the right and aorta is on the left. And because of that, left renal vein is longer and right renal vein is shorter. Now, this is the intravenous urogram. You can see the outline of the kidney. In this procedure, we inject dye into the vein, and the dye is now excreted from the kidneys, and you can start seeing the beginning of the ureter, which is like a bell-shaped opening coming from the kidneys. And this area is called renal pelvis. And now you can see the outline of the ureter running vertically, coming down into the urinary bladder. And if we look at carefully, these ureters ran at around the level of tip of the transverse processes of the lumbar vertebra, especially like lumbar 3, 4, 5. And it comes in front of the sacroiliac joint, and it comes into the urinary bladder from the posterior and posterolateral aspect of the urinary bladder. And now urinary bladder is filled with dye here already. So this is the cross section. This is the abdomen at the level of lumbar 2 vertebra. And this is the peritoneal cavity. This white lining is the peritoneum. And as we know, although the kidneys are in the abdomen, they are outside of the peritoneum. They are behind the peritoneum. And therefore, they are called retroperitoneal structures. And this is the right kidney, this is the left kidney, this is the blue on the right, which is the inferior vena cava, and this is the abdominal aorta, which is on the left side. And therefore, left renal vein is far longer than the right renal vein. And it shows the retroperitoneal position with the related arteries and veins. If we know this diagram, I believe it will be easy for us to interpret this CT scan, because everything remains the same. This is the left kidney, this is the right kidney, this is the vertebra, this is the aorta, this is the inferior vena cava, and this must be the left renal vein. So just try to interpret this diagram and this diagram together, because once you leave the anatomy class, you will be seeing these structures. And because kidneys are very much close to the posterior abdominal wall, and they are very closely located to the 11 and 12 ribs. And as you can see here, on the right side, right kidney is lower because of the liver. On the left side, left kidney is slightly higher. They are close to the 11 and 12 ribs. And if they are related to the 11 and 12 ribs posteriorly, I believe they are also very much closely related to the pleural cavity. And I want you to appreciate it, because if there is any injury in this region, for example, like any step injury there, the associated structures which are going to damage is not only the kidney, but also the pleura. And if you go slightly higher, might also be the lungs itself. So this is the explanation for the site of the kidney. And let's go to the size of the kidney. So those who have been in the lab, we know the size of the kidney might be just about the size of our fist, but in terms of measurement, the AP diameter is 3 centimeter, lateral diameter is 6 centimeter, and vertical dimension is 12 centimeter. And it's easy to remember, 3, 6, and 12. And like any solid structures, we have outer cortical portion and inner medullary portion. And the ureter, which starts as renal pelvis, which is like a very much dilated tubular structure. That is what we call renal pelvis. And renal pelvis will continue as the ureter. Its job is to carry urine from the kidney to the urinary bladder. And you can see the renal artery coming into the kidney, and you can see the renal vein leaving the kidney. And that area, which all the arteries going in and the veins coming out together with the renal pelvis, that is called the hilum. So I hope you remember the hilum in the lungs, hilum in the spleen, hilum in the lymph node, and now you are seeing hilum in the kidneys. So a bit more simple diagram, which is showing renal cortex, renal medulla, and the renal pelvis, and the ureter. And the junction here, which is the cortex and the medulla, this is what we call corticomedullary junction. So I hope this slide is no longer difficult for us now. It has explained everything we have seen here. And just a structure, when we are dissecting out the kidney, we saw the posterior peritoneum, we saw the fibrous capsule, perinephric fat, renal fascia, and pararenal fat. So we all see that. So now let's go into a little bit more detail. This is the cortical portion of the kidney. This is the medullary portion of the kidney. And these are in 2 dimensions, they are triangular. And in 3 dimensions, they are more like a pyramidal structures. That's what we call renal pyramids. And they open into small little collecting area. That is what we call minor calyx. And these minor calyx we've joined together to form the major calyx. And this major calyx we join finally into the renal pelvis. So this is the diagram I was talking about. This is the outer cortical portion of the kidney. This is the inner medullary portion of the kidneys. And now you can see here these triangular shaped structures, which we call renal pyramids in the medulla. And now I can show you the renal portion of the renal cortex invaginating in between the renal pelvis here. And they are called renal columns. It is here, renal columns. So the renal column is the portion of the cortex coming in between the renal pyramids, renal column. And now you can see the pyramids starting to form here, minor calyxes. You can see the minor calyxes here. And these minor calyxes will form into major calyxes. And finally, all the major calyxes enter to form the renal pelvis, which will continue as the ureter. So in the kidney, the pyramids we saw, plus the surrounding cortical tissue, which is renal column, it is called lobes. In each kidney, there are about 5 to 10 lobes in each kidney. The cortex, it extends into the medulla as renal columns. Medulla, which contain renal pyramids, and it has got longitudinal striations because we have the collecting tubules inside the renal pyramids, which we'll talk about these collecting tubules later in the chapter. There are a few terminologies which will make us confusing. The term called renal sinus. Renal sinus means at the region of the hilum, which is inside the kidney, so which includes the renal artery, renal vein, and renal pelvis in the inside of the kidney. Renal pelvis is the beginning of the ureter, which is the dilated portion. And major calyxes, there are 2 to 3, and minor calyxes, of course, they are 4 in the renal pyramids, and therefore they could be multiple. And the apex of the pyramids open into the minor calyxes. So now let's identify the renal artery. So this is the main renal artery coming from the abdominal aorta at the level of lumbar 1, coming into the kidney, and then they quickly, once they get into the kidney, they quickly divide into the segmental arteries. Look at that, segmental arteries. And these segmental arteries run in between the renal lobes, which is made of the renal pyramids and the renal column, and therefore they will be called interlobar arteries. And now these interlobar arteries will carve an arch on the renal pyramids in the corticomedullary junction, and therefore they will be called arcuate arteries. From these arcuate arteries, small radiating renal arterioles come out. They will be called cortical radiate arteries. So I want you to appreciate the hierarchy of the blood supply of the kidney. It starts with the renal artery, and then it will become segmental artery, and they run in between the lobes, interlobar artery, and then they arch on the pyramids, and therefore they are called arcuate arteries. And from these arcuate arteries, small little arteries come out. They are called cortical radiate arteries. They are like a sunshine radiating. And the nerve supply of the kidney is from the renal plexus. So I hope you will appreciate this renal artery, segmental artery, interlobar artery, arcuate artery, and the radiate artery. Of course, the blood vessels come in as renal artery and then leaving the kidney as the renal vein. So they are pretty much similar. They come from the artery aorta. They go back into the aorta equivalent, which is the inferior vena cava, which is the renal artery originate from the aorta. Renal vein enters into the inferior vena cava. We have segmental artery, although in veins, we do not have segmental vein. We have interlobar artery and interlobar vein, arcuate artery and arcuate vein, cortical radiate artery and cortical radiate vein. Here, there is some difference. From the cortical radiate artery, we have our afferent arteriole, afferent glomerular arteriole, which will form the glomerular capillary, and then leave efferent glomerular arterioles, and then they will continue as peritubular capillaries before they become cortical radiate arteries. So I'm going to stop here, and I want you to go back to the previous lectures, and we talk about the later part of the urinary system in the another video. Thank you for your attention.